Millions of Americans woke up this week to headlines screaming about a $500 per month increase in Social Security benefits. And if you are someone who depends on those monthly payments to cover your rent, your groceries, your prescriptions, your entire life, then of course your heart jumped a little. Of course you started doing the math in your head. Of course you wanted to believe it. But before you start adjusting your budget or calling your family members with the good news, you need to sit down and understand exactly what is being announced, who it actually applies to, and why the reality of this situation is far more complicated than any headline is willing to tell you. Let's start at the very beginning, because context is everything here. Social Security in the United States operates through several different programs that many people mistakenly treat as one single system. You have retirement benefits, which most people think of first. You have Social Security disability insurance, known as SSDI, which goes to people who have worked and paid into the system, but can no longer do so due to a qualifying disability. And then you have Supplemental Security Income, known as SSI, which is a needs-based program for elderly, blind, and disabled individuals who have little to no income or resources. Each of these programs has different rules, different eligibility requirements, and different payment structures. When a major benefit change is announced, it almost never applies to all of them equally, and that is where most people get confused or misled. The increase being discussed right now is tied to what the Social Security Administration calls a cost of living adjustment, or COLA. This is an automatic annual adjustment that is applied to Social Security and SSI payments to help recipients keep pace with inflation. The COLA is calculated based on the Consumer Price Index for urban wage earners and clerical workers, a specific measure tracked by the Bureau of Labor Statistics. When inflation rises significantly, as it has in recent years, the COLA percentage increases accordingly, which translates into higher monthly benefit amounts. The $500 figure being thrown around in headlines represents the potential upper range of what higher-earning beneficiaries might see added to their monthly checks over time, including when compounded with previous adjustments. But that number is not universal, and it is not guaranteed to land in your account the way the headlines suggest. Here's how the math actually works. The COLA percentage announced applies proportionally to whatever your current benefit amount is. If you are already receiving a higher monthly payment, say $2,000 or more per month, then a significant COLA percentage will naturally result in a larger dollar increase for you. But if your monthly benefit is on the lower end, perhaps $600 or $700 per month, that same percentage translates into a much smaller dollar amount. The $500 figure applies primarily to those who are already receiving closer to the maximum benefit, which in 2024 was around $3,800 per month for someone who claimed at full retirement age. So the people most likely to see gains close to $500 are those who worked for decades in higher earning positions, consistently paid into the system at maximum levels, and waited until their full retirement age or even age 70 to begin claiming benefits. If that is not your situation, your increase will likely be considerably smaller. Now let's talk specifically about who qualifies for any increase at all, because this is where a lot of people get left behind in these conversations. To receive retirement benefits through Social Security, you must have earned at least 40 work credits over your lifetime, which typically equates to about 10 years of work where you paid Social Security taxes. The age at which you claim also matters enormously. If you claimed early, meaning before your full retirement age, which is 67 for most people born after 1960, your base benefit was permanently reduced. That reduction does not go away when COLA increases are applied. You still get the percentage increase, but it is applied to your already reduced base. And if you have never worked or did not pay into the system, you do not qualify for retirement benefits at all under this framework. For people receiving SSDI, the situation is somewhat similar. SSDI benefits are based on your earnings record and work history, just like retirement benefits. COLA increases do apply to SSDI payments, so if you are receiving disability benefits through this program, you will see some increase. However, SSDI recipients often face a complex web of rules around working, medical reviews, and income thresholds that can affect what they actually take home. Additionally, many SSDI recipients transition automatically to retirement benefits when they reach full retirement age, which means their benefit structure may change even as new COLA adjustments roll out. SSI is a different story altogether. And this is where some of the most vulnerable Americans often find themselves disappointed by announcements like this one. SSI is a federally funded program, but many states supplement it with additional payments of their own. The federal base rate for SSI is set by Congress, and while it does receive COLA adjustments, the maximum federal SSI payment in recent years has hovered around $900 per month for an individual, well below the poverty line in most parts of the country. A $500 increase to SSI would be genuinely transformative for millions of disabled and elderly Americans living on the edge of survival. But the COLA adjustments applied to SSI are percentage-based, just like with retirement benefits, which means on a base of $900, even a generous COLA produces a much smaller actual dollar gain than $500. And strict income and asset limits for SSI mean that many people are disqualified the moment they receive any additional financial help, from family members, from state programs, from almost anywhere. There is also an important wrinkle that affects many Social Security recipients that almost no headline ever mentions: Medicare Part B premiums. For most people who are enrolled in both Social Security and Medicare, the Part B premium is automatically deducted from their Social Security payment each month. When COLA increases are announced, Part B premiums often rise at the same time, effectively eating into whatever gain recipients were hoping to see. There is a provision called the Hold Harmless Rule that prevents Social Security payments from decreasing year over year due to Part B premium increases, but it does not guarantee that your take-home increase will be anywhere near what the COLA percentage suggests. In some years, the majority of a COLA increase has been absorbed entirely by rising Part B premiums, leaving beneficiaries with only a few extra dollars, or sometimes nothing, in additional monthly income. Something else worth understanding is the concept of the Windfall Elimination Provision and the Government Pension Offset, two policies that have affected millions of public sector workers, teachers, police officers, firefighters, and other government employees for decades. These provisions were designed to prevent what lawmakers at the time considered double-dipping, receiving both a government pension and full Social Security benefits. In practice, they significantly reduced Social Security payments for many people who spent their careers in public service. Now, there has been legislation passed, the Social Security Fairness Act, which was signed into law and is intended to repeal both of these provisions, potentially restoring significant benefits to nearly 3 million Americans who were previously penalized by them. If you or a spouse worked in a job not covered by Social Security, like certain state or local government positions, this change may affect your eligibility and payment amount in a meaningful way. The Social Security Administration is in the process of implementing these changes, and some affected individuals may see retroactive payments as well. Understanding your own benefit requires you to look at your personal Social Security statement, which you can access by creating or logging into your account at the official Social Security Administration website. That statement will show you your projected benefit amounts based on your earnings history, the age at which you plan to claim, and your current work record. It will also flag any issues with your record that might affect your payments. This is genuinely the most important financial document many Americans never bother to read, and it should be reviewed at least once a year, not just when headlines start circulating about increases. If you are not yet receiving benefits and are trying to decide when to claim, the timing decision remains one of the most significant financial choices you will ever make. Claiming at 62 locks in a permanently reduced benefit, waiting until 70 locks in the highest possible monthly payment, an increase of roughly 8% per year for every year you delay past full retirement age. For someone in good health with reasonable life expectancy, waiting can result in dramatically higher lifetime income. For someone in poor health or financial hardship who needs income immediately, claiming early may make more sense despite the reduction. There is no universally right answer, but the decision deserves careful, personalized analysis, not a snap judgment based on a viral headline. The broader conversation around Social Security is not going anywhere, and in fact it is becoming more urgent. The Social Security trust funds, particularly the Old Age and Survivors Insurance Trust Fund, are projected to face depletion within the next decade if Congress does not act. When that happens, benefits would not go to zero, but they would be automatically reduced to whatever can be funded by incoming payroll taxes, which current projections suggest would be around 80% of scheduled benefits. That is a significant potential cut that would affect every single recipient. Lawmakers on both sides of the aisle know this is coming. What they will do about it, whether through benefit cuts, tax increases, retirement age changes, or some combination, remains genuinely uncertain. It is one of the most consequential policy questions facing the country, and it will directly shape the financial security of tens of millions of Americans for generations to come. What you can do right now, regardless of where you are in this process, is get informed and get specific. Do not rely on headlines that flatten a deeply complicated system into a single dollar figure. Know which program you are in or will be in. Know your earnings record and your projected benefit. Know how Medicare premiums will affect your take-home. Know whether you are affected by the Windfall Elimination Provision repeal. And if you have questions you cannot answer on your own, reach out to a financial advisor who specializes in retirement planning, or contact the Social Security Administration directly. Their representatives can walk you through your specific situation without cost. The system is complicated by design, and the only way to navigate it effectively is to understand exactly where you stand within it, not where a headline says you might.